I'm Dr. Hema Vaidyanathan, fertility consultant from ISS Fertility Chennai. So today in this session, let me talk to you about understanding basic fertility testing. So any couple when they come for fertility evaluation or they present to us with fertility issues, so what is suggested initially is the basic fertility evaluation to them as a couple. So both for the men as well as the women, there are certain basic testing that is ordered to understand about the presence of any fertility problems. So in this session, let me talk to you more about this fertility testing and what are the basic fertility testing that is done for women as well as for the men. So first so before understanding the testing, let's understand initially about the fertility and about infertility and then about the basic fertility testing. So, what is fertility? So, fertility, the definition by the word definition goes like the state or quality of being fertile. So, for a human fertility, when we consider the percentage of human fertility in a month, it is no higher than 33% in a menstrual cycle. That is the chance of pregnancy per menstrual cycle. In most fertile couples, even if there are no fertility issues, also, it is not higher than 33%. So, there is a concerning fact. Worldwide, there is a decline in the global fertility status of people. So, which is a concern which is brought about by various factors because of evolution in various sectors. So, this declining global fertility is being addressed by taking a lot of the health or lifestyle measures that can improve fertility. So let's understand more about that in the later slides. So the requirements of female fertility is that the normal reproductive anatomy has to be maintained and it has to be functioning. That is what is called as a physiology. The normal function of the reproductive organs has to be normal, and also the anatomy or the physical anatomy of the reproductive organs like the uterus, the fallopian tubes, and the ovary has to be normal in order for female fertility to be normal. So there has to be an adequate sexual function. The normal immunological response to accumulate the sperm and the pregnancy has to be normal. And also the women in general should have a normal nutritional and normal health status in order to adequately support a pregnancy and to end up in a healthy life delivery. Also, similarly, the requirement for a male fertility is that the man must be producing healthy sperm in sufficient quantities to fertilize, and there should be normal spermatogenesis and normal ductal system as such. There should not be any ductal blockages because of an infection or because of congenital abnormality, so that it maintains a male's fertility. So whenever a couple present with fertility problems, or not all of them will have infertility. So infertility, as such, the word definition is that there is difficulty or inability to reproduce naturally, but not all couples will have infertility as such when they present to us with fertility concerns or fertility problems. So infertility is diagnosed when only when there is inability for the couple to conceive after they have been trying to conceive naturally for at least 12 months, and they should be trying with an adequate frequency for the at least 12 months, and they should not be using any form of contraceptives. So only after that we'll be able to know that there has been an infertility situation which needs further assessment. Also with the infertility, there are types. There can be either primary infertility or a secondary infertility. So primary infertility is when a couple has never had a pregnancy before, then the situation is a primary infertility. Or if the woman has had a pregnancy before, whether regardless of the outcome, if the woman had achieved a pregnancy before, then it is a secondary infertility. Then the type of testing that we advise and the type of treatment can vary between a primary and a secondary infertility situation. So what are we doing these fertility tests for? So we are doing these fertility tests for to understand if there is any underlying problems that we can correct in order to enhance your natural fertility or in order to help with the natural conception itself. So only if natural conception is not possible, then you would be going ahead with a fertility treatment with ovulation induction treatment or an IUI or an advanced form of treatment like IVF. So the first step is to identify the underlying problem as such. So when we are testing, we find out that the underlying male factor in about 1/3 of the couples, underlying female factor as a problem causing their infertility in about one third of the time, and about in one third of the time the problem is combined factors, like either because of a male factor as well as the presence of a female factor. So most of the time the problem is can be in both the men as well as in the women. So it is important that we test both the men and the women when we encounter a fertility problem. So to understand the concepts of these testing, to understand that the three main events necessary for a pregnancy is ovulation should happen naturally in the women, and then there should be natural fertilization of the egg and the sperm, and then the resulting embryo should implant in the uterus successfully for a conception to occur successfully. So that's how the tests are tailored. The fertility tests are tailored in order to identify the defects in ovulation, the defects in fertilization, as well as the defect in the implantation. So ovulation, as mentioned, it's a process by which a mature egg is released from one of the women's ovaries, and fertilization usually takes place in the fallopian tube in the women's near in the fallopian tube of the women's reproductive organ, where the sperm unites with the egg, and then the resulting embryo moves down the fallopian tube and it moves into the uterus and then implants there. So fertilization is a process that happens in the fallopian tube, and then implantation happens in the uterus, where the embryo gets attached to the uterus, the uterine wall particularly, and then it grows from there as a pregnancy. So any process, any disease process or any issues that affects the ovary and affects its ovulation, affects the fallopian tubes or affects the uterus, or in the male factor side, if any abnormalities in the sperm can affect all of these and can impair and cause fertility issues. So fertility issues can be because of problems in any of these areas. So let's understand the critical factors that can cause fertility issues, or any problems affecting the quality of the egg or the quality of the sperm, or any disease process affecting the uterus and the fallopian tubes can impair a person's fertility. So also most important factor is the women's age, because women's age, as we age, there is a decline in the quantity as well as the quality of the egg. So the peak fertility, the peak fertile age for a woman is in their late 20s. So pregnancy in the late 20s are considered the most healthy pregnancies, and because the women's fertility is peak at this age between 20 to 24, and then after 30 years of age there is a decline in a women's fertility, and there is a rapid decline in the women's fertility after the age of 35. So let's go back to our topic, which is the basic fertility testing that we do. So one of the common and the most important tests that should be done is the test for ovulation. So what do we do in this test of ovulation is, there are certain tests that women can do at home on her own to identify if she is ovulating regularly. So some of these tests are not commonly done these days, or some are being done. So basal body temperature is one such test which is not commonly done these days, where women can take her own body temperature daily in the morning to check if she has ovulated, so that after ovulation there is a rise in her body temperature, which can be detected by tracking her daily body temperature. And the other commonly done test is the urinary LH detection, which can be done by the ovulation test kits, which is commercially available, which the women can use it to detect the presence of the LH hormone, which is usually gets surged, or there is a surge in this hormone before ovulation, so which can be detected by urinary test kits, so that the woman understands her time of ovulation. So this is an over-the-counter test also, it can be done, which is a urinary LH detection. And next is the most confirmatory test can be the ultrasound way of testing the follicular growth and the ovulation. So which is ultrasound folliculometry is the most commonly done test. But it's a little advanced type of test where you have to go to a healthcare professional to track your follicular growth and to identify that if you're ovulating regularly. And next is a hormone test, is a blood test which can be done 1 week after your preceding day of your ovulation to detect if your progesterone hormone level is rising. So which is actually an indication that you have ovulated in that cycle. So doing a mid-cycle serum progesterone is one of the way to identify that if you are ovulating, if you are ovulating regularly. Another test is, which is a little invasive test, is in doing an endometrial biopsy, but which is not a regularly done test. So the regularly done test is to use an ultrasound to track your follicular growth and ovulation, or the blood test, which is a mid-luteal serum progesterone test, or the over-the-counter urinary LH kits. So this to identify your egg count is also an important test, which is known as an ovarian reserve test, because not all men will have an equal number of an ovarian reserve, because some women, if they present with fertility issues, they may be having a problem of low AMH. So identifying your ovarian reserve is one of the tests done to identify the underlying fertility problems. So the common test done in this area is AMH test. So AMH is a blood test which can give us an idea about the egg reserve or the ovarian reserve of the women. Another test which is commonly done is a basal antral follicle count, which is an ultrasound based test. So this test, if it is done transvaginally in the first few days of your menstrual cycle, we'll be able to assess your ovarian reserve, and also it gives us an idea about your fertility problem as such. So that was about ovulation, and that was also we saw about ovarian reserve testing. So next is about uterine evaluation, so which is, I think, it's a basic and most important test to assess the uterus itself. So how the uterus can be assessed is usually by an ultrasound. We'll be able to detect if the uterus has any physical issues like fibroids, or the presence of adenomyosis, or the presence of defects in the uterus, known as congenital uterine malformations, can be detected easily by an ultrasound. Either a two-dimensional ultrasound or a three-dimensional ultrasound can help us better understand the anatomy of the uterus to see if there is any underlying fertility problems that it might cause. And also there is another advanced various testing like sonohysterogram to understand if there is any polyps, or if the cavity or the inner lining of the uterus, if it is affected, we'll be able to better know with this test known as sonohysterogram. And also the X-ray based hysterosalpingogram also can give us an idea about the health of the uterus. And if needed, MRI can be done in certain situations, especially if there are multiple fibroids or adenomyosis or endometriosis. This can give us an idea about the health of the pelvic organs. And also hysteroscopy is the most advanced test and the most essential test that give us information in case necessary about the inner linings of the uterus endometrium health, as well as the any congenital uterine malformations if it is there. We'll be able to better identify by hysteroscopy, and we will also be able to treat it simultaneously with the hysteroscopy. So that is about uterine evaluation. And the next basic test is about tubal patency testing. So to understand if there is any fallopian tubal blockages, tubal patency tests help us. So there is so much in the list, but what is commonly done is HSG or an SSG or a laparoscopy and a dye procedure. So X-ray test like HSG is a very commonly done test to identify if there are any blockages in the fallopian tubes. So if HSG is not confirmatory, then usually we go about and do a next level testing, sometimes like laparoscopy and dye, to identify if there are any real fallopian tubal blockages is persisting. So then tubal patency testing is a very basic fertility testing for women, done to rule out any problems in the fallopian tubes. So these are about the fertility tests that are done for women. So to list again, it is test for ovulation, and test for ovarian reserve, and the test to identify the uterus health, and test to identify the problems in the fallopian tubes like tubal patency testing. So these are the tests for women. And then for men, the most basic testing for fertility evaluation for men is semen analysis. So any couple presenting with fertility problems, a semen analysis of the men is a basic test. And if there is any abnormality in this test, then it should be repeated. And there are even other tests can be done, like the extended test for fertility evaluation and advanced test for male fertility evaluation are available too. So what is happening in semen analysis is the semen is tested for the presence of the quality of the sperm is analyzed. So the sperm count is analyzed, the way the sperms move, the motility is analyzed, and the shape of the sperms, like the morphology, is analyzed. So any problem in these parameters can affect a man's fertility. So the concentration or the count, the motility or the movement of the sperm, and then the shape of the sperm, analyzing this is very important to understand the presence of any fertility problems in men. So after basic semen analysis, if there are any abnormality, then we suggest an extended evaluation and sometimes an advanced evaluation based on the parameters seen in the basic semen analysis. So history and examination of the man is very important under very basic fertility evaluation. Also, if there are any abnormalities, then hormone evaluation is important, and ultrasound evaluations also may be necessary as a second or an extended testing if is necessary. Advanced fertility testing like genetic testing or performing a biopsy also may be necessary in selected group of men. So this is about male fertility evaluation. So sometimes fertility problems, or the women or the couple, they present with fertility problems only if they attempt to conceive, and if they are not successfully conceived, they present to the for evaluation. But sometimes we can, and there are certain signs. With understanding these signs is important, so that we know that it might present as a fertility issue in the later period. So if we have any menstrual problems or body weight issues or repeated pregnancy loss, or if we or the woman had a previous sexually transmitted infection, or if there is any excessive smoking or excessive alcohol consumption, or if there is any environmental exposure to toxins or high temperature, or if the couple has sexual dysfunction, these are all signs that there may be underlying fertility issues, and this may hinder fertility or conception in a woman. So, in presence of these potential signs, then it is a sign that you will need a fertility evaluation earlier. To identify the underlying problems. There's special mention about irregular period in a woman. So irregular period can sound like only a menstrual problem issue, but it can cause underlying fertility problem as well. So there is a link between menstrual abnormalities and the women's fertility issues, because menstrual problems can be present because of so many underlying problems, underlying hormonal issues, underlying body weight issues, and underlying thyroid issues, and underlying issues with the ovary as well. So hence, any irregular period is a sign that there could be underlying fertility problem. So because irregular period can happen because of the most common gynecological condition like PCOS, or can happen because of hormone abnormalities like thyroid abnormalities, or having abnormal prolactin issue. Also, if there is egg count is low AMH or primary ovarian insufficiency also can bring about irregular periods. Hence, if the woman has an irregular periods, it's most important that she come for assessment um, to identify the underlying problems. So those were about the basic fertility testing for men and women with present with fertility issues. I hope these covered the understanding about basic fertility testing. Thank you all for your patient listening. Thank you.